Hi, I'm Karen Borda with CBS News Texas, and joining me today is Dr. Betsy Kennard, a pediatric psychologist with Children's Health and UT Southwestern Medical Center. Now, Doctor, a CDC report released in mid-February shows that 3 in 5 teenage girls in 2021 was experiencing sadness or hopelessness. It was the highest level in 10 years, and it was 2 times the number of boys who experienced the same feelings. So what did the CDC report, in your mind, tell you about the state of mental health among today's young people?
Yes, well, it certainly is worsening, as you can tell. It is a big concern in terms of it was happening before the pandemic, but certainly worsened during the pandemic. We are seeing certain groups are affected more, that certainly girls are affected more. We're also seeing that certain populations like LGBTQ populations are affected more, and those under 12 who are Black or Hispanic tend to have higher rates too. So we're concerned about what's going on nationally as well as in our area.
So you mentioned that this isn't completely a pandemic related thing, a COVID isolation thing, but those numbers have ratcheted up since then. So do you think there is a connection?
I think there are a lot of factors. I think the pandemic is one factor. For example, one of the things we know that protects children from suicidal ideation or depression is school and family connectedness. And being connected is something that didn't happen much during the pandemic. So I think it did worsen it. I think there are other factors such as school stress. Some of the kids that did miss school or are trying to get back into school are struggling with grades. I think that's a big factor. I also think that overscheduling is a factor. I think that social media plays a big factor. Kids are on their phones way too much and often at night, so that impacts their sleep. So they're on screen time, and that involves light, which also affects their sleep, but also they stay up later. And there's a lot of bullying. We're seeing a lot of bullying here at Children's for kids that are coming in for mental health treatment. And we are noticing that kids are more often exposed either through media or other places, exposed to trauma and violence. So there are a lot of factors there.
I've heard, self-image, that kind of thing. You touched on the social media aspect of it. Do you think some of these things go hand in hand? The social media, self-image, bullying, that kind of thing, all of those things, it seems like could lead to someone's mental status spiraling out of control.
Yes, I agree. And also, as unlike when I was growing up, these things are with them all the time. So there's no way to just, when we were bullied as a kids, we could go home and be protected and it would stop. But these kids, it's constant, it's 24/7. So I think they're connected, as you said. I think that the screen time has gotten to be a huge problem for families, as as well as kids, and we need to protect our kids.
And you were speaking in terms of the CDC report and the groups of kids who were affected. And you also mentioned Hispanic and African American children under the age of 12. Is that what you said?
Yeah, for Black males under the age of 12, the rates have risen. In general, we see that we have heard more reports of racism in schools, and those kids that are affected by racism, which tends to be Black, Hispanic, and Asian, tend to report lower levels of mental health.
Now, this was a national report. It was a nationwide study.
Yes.
Would you say that it's also reflective of what we're seeing here in North Texas?
Yes, I would. And I think what's so important about this report is they go into high schools and sample those kids in high school. So those are what you would call, those are people not necessarily in treatment, not necessarily seeking help, and yet the rates are very, very high.
So you talk about the signs. Let's talk about that. The things that we need to look for in our children. Are the signs of a mental health crisis or disorder different in teenage girls than in teenage boys?
That's a great question. In terms of diagnosis, a lot of the signs are the same in terms of what you're looking for as a parent. You're looking for a change in school performance, lower grades, a change maybe in their peer group. Maybe they've changed peer groups or they've lost friends. They report interpersonal conflict. I think that the things you're looking for are changes in sleep and appetite, as well as mood. I think talking to your kids about how they're feeling, what their mood, you may not see sadness in your family. Your child may show irritability, which is also a symptom of depression. So really connecting with your child and trying to understand what they're going through. I think girls, particularly adolescent girls, are a little more at risk after puberty because of hormonal changes. So they may be more at risk, but I also think they're also very sensitive to social feedback and media feedback, social media or bullying, maybe more, they may feel it more emotionally than boys who might act out more behaviorally.
So what do you say to people who say, this is just a part of growing up? It's a part of adolescence and you're going to be just fine. What do you have to say to people who just are dismissive?
I think that what I'm talking about is not normal adolescence. I mean, pervasive sadness, hopelessness, having no purpose or few reasons for living is a lot of the language we use. That is not normal. An occasional conflict with peer is one thing, but when you're finding persistent sadness or persistent conflict, lower grades, poor sleep, all screen time, no social contact outside of screen time, we don't consider that normal.
So parents, when they're starting this conversation, how do they do that? It's a very difficult first step.
Yeah. I think kids appreciate transparency. So if somebody's watching this, you could say, hey, I just watched this news show and the rates of sadness and hopelessness and suicidal thoughts are going up. Let's talk about that in our home, how this might be affecting you and your friends. And opening that conversation, I hear parents tell me a lot, they're afraid to talk about it because they don't want to put the idea in their child's mind. And that is not, there's no research that supports that. It actually is not true. These kids have been exposed to it. They've thought about it. You're not going to put that in their mind. And in fact, giving them an outlet to talk about it is an area of, is a way to provide support and help them to get care if in fact you feel like they do need to get care.
And speaking of that, you are a child psychologist, and it seems to be a rare breed these days. We've reported at length, over the last several months about how difficult it is for families to find mental health care for their children just because there are so few providers. What do you think can be done to address the shortage of mental health professionals in our country?
I totally agree with that. And we are training psychologists here at UT Southwestern and Children's trying to address the problem. One of the most recent reports came out that Texas is number 50 in the states, ranks 50, the bottom, in terms of access to care. And it's certainly worse in rural areas than it is here in DFW. But in DFW, it's even hard to get access to mental health providers. I really respect and love pediatricians. I think you have access to pediatricians and they can help. Children's health can help. We have people that answer the phone in our child psychiatry program, and they can help connect you to care if based on whatever your finances are or your insurance plan. But MetroCare, there are a lot of good places in Dallas. We're lucky in Dallas-Fort Worth to have such good people and agencies, but I'm not going to say it's not a problem. It's a problem, and we need to grow the mental health field.
Is there anything else you want our viewers to know about this topic or anything related to it?
I think we need to protect our children, and I think we need to talk to our children. I think we need to have dinner with our children, and we need to have a basket on the table where the cell phones go, or off, maybe better off the table. We need more time with our kids, and we need to model for our children because I've been guilty before where I've come home and I've been on my cell phone. That needs to go away. Family time needs to be protected. We know that family dinners are protective. We know that kids that are more resilient are kids that have very good connections with their parents as well as their friends. So fostering those relationships help protect your child.
Dr. Kennard, thank you so much for being with us today. Really great information.